The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, interventional cardiologist Dr. Annie Varghese talks about the dangers of heart disease in women. Gynecologist Dr. Scott Lauer talks about how the InterStim device can successfully treat urinary incontinence in women. Bariatric surgeon Dr. Scott Stowers with My Bariatric Solutions helps his patient lose weight. Cosmetic dentist Dr. Guy Lewis talks about some unique procedures in dentistry he has developed.
My husband and I got married when we were 30 years old, and we wanted to try for a family as soon as possible. After a couple of years of just trying on our own and going to our OB, we decided that we needed some help.
It's a very frustrating experience to know what you want and not being able to do it, where you see other people, your friends, your other family members being able to have a child, and then you can't have that.
You look to your spouse and you cling for support because you feel like you're the only ones that's dealing with this issue, and it can be embarrassing, and it's something that you just thought it would come natural, and it doesn't, and it didn't for us.
Being the husband in this situation is a lot different, I think, than Stacy's experience, because you feel bad for her. I think she took it a lot harder than I did.
We started the IVF journey back in 2012. So Dr. Kaufman and his team came up with a plan for us to go through 10 weeks of shots and to prepare my body for what they call retrieval, egg retrieval. So it's shots and medications and blood work, and then we implanted at day 5, and then it's the waiting game, and that was the longest 2 weeks of my entire life. The office called, the nurses were on the phone, the doctor was on the phone, and they're like, "You're pregnant, congratulations." And it was just a moment of relief and joy, and all that hard work, the dedication that we had put in as a family and Dr. Kaufman's team, it paid off.
To finally have that feeling, to know that our son was on the way, is just something that you cannot even explain in words.
We had a healthy 5-pound, 10-ounce baby boy named Bryce. He has just been the best thing to come into our lives.
Sweet potatoes boast a wealth of antioxidants, phytochemicals, and several vitamins. The fiber in sweet potatoes promote a healthy digestive tract, and the antioxidants help prevent heart disease and cancer. The natural sweetness of a roasted sweet potato is delicious without any additional fats or flavor enhancers.
I came to see Dr. Varghese on the advice of my primary care physician because my blood pressure was a little elevated and my EKG reading was a little off. She suggested that I take a stress test and have some other procedures done just to determine the causes of that. And it was determined that I did have blockage in one of my arteries, and a stent had to be implanted. And then reality sunk, and Dr. Varghese talked to me during the recovery time, and I asked her, in tears, I asked her what was going on. I asked her, was I about to have a heart attack? And she said, no.
Yolanda Garcia, to this day, she's so thankful that her primary care was cognizant enough to send her for evaluation, because many times primary doctors or nurse practitioners who see all of these patients they may not recognize because the patient's not complaining much. So I think this is a wake-up call for all of us as physicians and healthcare providers to really focus on prevention, evaluating the patient early, getting them to the right specialist on time.
Because of her, I'm able to take care of my clients. Because of her, I have a better life. So I really am appreciative of all she has done for me.
Well, coronary disease in women especially is it's the #1 killer of women in this country, and pretty soon will be the #1 killer of women all over the world. And in Hispanic women especially, there's a high prevalence of diabetes. So therefore diabetes lends towards cardiovascular disease and coronary disease especially. It's just so important to educate our Hispanic population, our Indian population, because Indians die 4 times the rate of any other population from diabetes and cardiovascular disease. People are hungry for knowledge. It's just for the lack of knowledge we perish.
Find your doctor on bestdocsnetwork.com.
Or we could try a trial of the InterStim procedure.
I wore it for a week and it helped. I fell in love with it, and then I decided that, yeah, this is what I need, and then we went back and put a permanent one in.
With her InterStim procedure, Jolynn basically is treated or in remission. She's actually doing excellent.
I think it's been right about a year since I've had it. I don't know what was happening inside my body, but that InterStim did it. It fixed it. So for me personally, I mean, it's just made me, I don't have to worry about it. You know, it's just, I feel great. I always feel good. I don't ever have that issue.
Marla has a question for Dr. Peter Morgan. What are the causes of venous insufficiency?
The risk factors or causes of venous insufficiency are, first of all, genetic or hereditary. Patients that have parents or grandparents or aunts or uncles that have large varicose veins are more likely to have disease that is caused by a genetic predisposition for the veins to get larger. The second risk factor is lifestyle issues, including jobs, occupations, or hobbies that result in standing or sitting for long periods of time.
Ask our doctors on bestdocsnetwork.com.
The volatile oils in ginger have long made it a useful herbal remedy for nasal and chest congestion. Pour 2 cups of boiling water over a 1-inch piece of peeled and grated ginger, steep for 10 minutes, and strain. Add a pinch or 2 of cayenne pepper to the water and drink as needed.
I've been a patient of Dr. Lewis's for several years. My teeth were aging, and also the color was not as good as we'd like it to be.
Over time, as our teeth wear down, our nose and our chin get closer together because our teeth are what hold our nose and our chin apart. And as our teeth grind down, then this dimension of our face starts to collapse. Carol started noticing over time how her teeth looked more and more ground down. So she had worn through the enamel. She had dark spots in her lower teeth. Her upper teeth were real flat and short.
He discussed with me to have the crowns or veneers to give me a little bit of a lift, a smile lift.
We call it a smile lift. It's kind of a play on a facelift because it actually makes your face look younger and longer. And so by going in and opening up their bite and making their teeth a little longer, then it just makes them look so much better.
I thought about it for quite a while because I wasn't really sure if I really wanted to do that. With my husband's prompting, because he had had the procedure and it was wonderful and had a great experience, I decided that I would do it also.
We did all of her teeth. We opened up her bite, which gave me room to make her teeth longer. Now she looks 15 years younger, whiter teeth, which is more youthful. It really made a huge difference on her, and she is so happy. She's such a sweet lady anyway, but now she just kind of radiates this.
I'm very pleased with the way it turned out. Friends and family, they don't say, what did you have done to your teeth? They have a tendency more to say, your teeth look really nice. They can't quite figure out why they look better, which is really what I was hoping for. I just take care of my teeth like I always did, and I'm very, very happy.
I didn't feel good about myself, and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends, and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren, and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
In an emergency, your most important need is time. Time saved in the hands of highly trained doctors and experienced emergency nurses. Time saved with advanced imaging and diagnostics to help find a solution quickly. No matter what hour or day, we are here for you. Because when your life is on the line, what matters most is time. Texas General Hospital. We care.
Coming up on the second half of today's show, neurosurgeon Dr. Jean-Louis Benet discusses the cervical fusion procedure and how it has helped some of his patients overcome neck problems. Family medicine Dr. Richard Honecker addresses common health concerns in our Medical Minute. ENT Dr. C.T. Wynn relieves his patients' inability to breathe and nasal congestion by diagnosing their deviated septum. Houston Northwest Medical Center highlights their nurses' commitment to patient care as well as to their community.
For years, I had been plagued with what I thought was just like a pulled muscle in my neck. And it just kept getting worse and worse the more I did and the older I got. And it just would not go away.
She was having difficulty running and doing the typical activities that she will do on a regular basis. Julie is someone that's very active. She's a runner, works out. As she was noticing that she was just not able to carry out the level of activities that she was able to do before, she came and sought some help. We got some pictures of her neck, and sure enough, we saw that she had developed pretty advanced degenerative changes of her cervical spine, and there was some bone spur that were pushing on the nerve.
He gave me all the information, and I walked out, and I kind of thought about it, and I went to physical therapy, still didn't work, and then that's ultimately when my husband and I went back in and talked to him and said, okay, this is not a way to live.
After failing to essentially improve on conservative measures, we decided to proceed with an anterior cervical discectomy and fusion. Essentially, that is a procedure whereby we get into the joint of the neck from the front and restore the height of the disc, clean up all the bone spur, relieve the pressure of the nerve, and fuse those diseased joints. We watched Julie in the hospital for about 2 days, and then after that she went back home, and she continued to just recover adequately.
I'm so glad that I did it. I've actually told some friends that have been putting it off, and they've gone to see him. They've had great results. Do you want to walk around constantly being in pain? No, it's not worth it. And sure, you got to slow down for 12 weeks, but now I'm back to where I was, and I'm very happy that I've done it. I just moved slowly and methodically, listening to the plan between Dr. Benet and the physical therapist, and here I am now. I'm back and even better.
Request an appointment on bestdocsnetwork.com.
Let's talk about self-breast exam. It turns out that self-breast examination is not only of no benefit, but it's probably harmful, and we don't recommend it anymore. Here's why. Women who check their breasts regularly tend to find lumps at a far greater rate than bad things happening in those lumps. For example, women will find little lumps that don't matter. They'll go to their doctor, they'll end up with special imaging procedures like mammograms and MRIs, and then they'll get biopsies that don't need to be done. I know it sounds a little funny to ask you not to check for lumps, but we just know that populations of people that check for lumps on a monthly basis tend to have more unnecessary surgeries and worries and anxieties over those lumps than those patients that don't. Basically just use common sense. Maybe every few months check your breasts, and get your mammograms yearly if you're at the right age, and have your breasts checked by your physician. Also remember one thing, there's more breast tissue in the upper outer quadrant of your breast. Divide your breast like a pie into 4 quadrants. The upper outer has more breast tissue there. Pay attention to that.
Gosh, I was young, maybe about 6 years
to improve the nasal airway?
Very simple outpatient. You know, everything was explained to you. Go in the morning. I actually took a little nap right before surgery because it was early in the morning. Woke up and that was it. So it was real simple, real easy.
Joey's quality of life has improved tremendously. He breathes better, he sleeps better, and he enjoys life more.
Well, you know, you just don't realize it because I've had it for so many years. You just get used to, you're thinking the way you're breathing is normal, and it's not. And then once it's changed the way it is, you know, I'm able to do things without getting winded, you know, because I'm not having to open my mouth to breathe now. I'm able to breathe clear through my nose.
The number one reason that patients come and see me is because they can't breathe through their nose. In most of the case, there's a solution for that. As a Center of Excellence in Nose and Sinus Disease, I'm always in the forefront of medical research to improve my patient outcome. Medicine has advanced so much that there's always a solution to breathe well and live well. Patients don't have to suffer anymore.
Cranberries contain a substance that appears to keep bacteria from sticking to the walls of the urinary tract and has been shown to help prevent UTIs. For best results, drink unsweetened cranberry juice diluted with water or take capsules of powdered cranberry extract.
Diane has a question for Dr. Guy Lewis. What is the best way to get a wider smile?
Well, there are a couple of ways to get a wider smile. One way would be to bleach your teeth. Bleaching can work well for some people, but it doesn't work well for everyone. It just depends on the makeup of your teeth. So that's an easy way to try and see if it works for you. But for a more predictable result, and something that is going to be exactly like you want it to be, then doing veneers is the best way to do that. We can make them any color you want. We can change the shape, size, a lot of different things, but the color can be picked out and said, this is the color I want, and that's the color we can make them. With bleaching, you also have maintenance, whereas you bleach them up, and they may not stay that color for very long. You may have to bleach them every 2 or 3 months to maintain that. So doing veneers, you do it, it's done. Doing the bleaching, more maintenance, but you can get a good result with the bleaching.
Ask our doctors on bestdocsnetwork.com.
At Houston Northwest Medical Center, we're immensely proud of the wonderful group of nurses that we have at our hospital, not only for the care they give to our patients every day, but also for the way that they've reached out and become so involved in our community.
Their commitment to the patient here at Houston Northwest is amazing, but in addition, above and beyond these four walls, they carry it out to the community. And that's evidence in all their volunteer work, through runs, through patient support groups, through educational opportunities they offer to the community.
One of the reasons that I really like working for Houston Northwest is its philosophy, its commitment on giving back to the community. And so when an opportunity came up from Spring Independent School District for me to be a part of their education foundation, the hospital was very supportive in not only its financial resources, but allowing me the time to be able to participate at a high level of engagement with our school district.
Race for the Cure has become a really important tradition here at Houston Northwest Medical Center. Living the walk with these ladies, they allow you to walk beside them, behind them, in front of them, holding their hands. That's very important. That's something you cannot buy or you can express in words, really. I'm very honored. I am honored to be part of their lives and do whatever I can to help them along the way.
When I first started working here is when I got involved in the Heart Walk just as a participant. And after just participating for a couple of years, they asked me to kind of take it over. And so now that's what I do, is I help raise money for the American Heart Association Heart Walk. Relay for Life is the biggest fundraiser sponsored by ACS. So American Cancer Society is always collecting donations to go towards patients that are underprivileged or that need resources when facing their diagnosis. It's humbling because I get to see patients come in that get a diagnosis that is life-changing, and then to be able to see them walk around the track as a survivor or one of their family members to walk around the track in remembrance of them. I feel lucky that I get to be the person to represent our hospital in that. I love my job. It's fun. It feels good to be helping people live a healthier lifestyle.
Obviously, we're very proud of the quality of care that's provided at Houston Northwest Medical Center, and our nurses are the driving force behind that. But their commitment to quality care and their commitment to our community extends well beyond the walls of our hospital through the many charitable and healthcare awareness events that they participate in actively throughout the year.
I think that gets to the core of nursing here. There's a heart, a big heart.
To warm up cold feet, sprinkle a bit of cayenne pepper into your socks. This remedy may help warm your toes by increasing circulation and improving blood flow.
A vasectomy reversal in general entails reestablishing the sperm flow from the testicle through the vas deferens and into the rest of the reproductive tract so that sperm can be found in the semen again and people can conceive naturally. There are different ways to do that, but the best approach is always a microsurgical approach to magnify these small, delicate structures and achieve the best, most precise realignment possible. The vasectomy reversal is a more involved procedure and usually requires several hours and is best done under a general anesthetic. So the patient needs to be healthy enough to tolerate a general anesthetic for about 3 hours. I find that patients are generally happier as well, having been asleep and waking up having their procedure all finished. We take into account different variables when considering who is a candidate for a vasectomy reversal. Believe it or not, the age of the female partner can impact whether a vasectomy reversal or surgical sperm retrieval and in vitro fertilization is the right choice. That's something that in the office we go over extensively because we want to make sure we make the best choice for that couple. When somebody decides that vasectomy reversal is right for them, we pick a date and they'll have their procedure. And then I usually see them 2 weeks after their surgery just to check their wounds and see how they're doing. I like to check for return of sperm into the semen fluid about 6 weeks after their procedure. Then continue to follow them until they achieve pregnancy. Success rates of the procedure do vary based on how long it's been since your vasectomy was done. If your vasectomy is 5 years old or less, you can expect an 85% success rate or better. If it's been more like 15 or 20 years since your vasectomy, the success rate is probably going to be between 50 and 60%, and you'll find numbers in between there based on the time since your procedure. Because of the delicate nature of the surgery and the connection that we make, we don't want our patients to overexert themselves for the first 2 to 3 weeks after surgery. We also ask that they abstain for 2 weeks, and then they're free to increase their activity as tolerated.
Watch more videos on bestdocsnetwork.com. Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.